So imagine this. You just finished a 12-hour shift, exhausted but proud of the care that you've given. Then a few days later, you're called into a meeting. A mistake, one you didn't even realize, has been linked to your name. And suddenly, your license, your career, and your livelihood are on the line. This isn't just a hypothetical situation, it's a reality for too many nurses. Today, we're diving into how to protect your license by putting patient safety first, navigating unsafe situations, and holding the system accountable. Let's ensure that this story never becomes yours. And so this evening's presentation is entitled You Are in Jail. My name is Nurse Eunice. I am in Jacksonville, Florida. I'm a nurse educator and a business owner, and I want to talk about how you can protect your patients and protect your license. This video isn't just for nurses because CNAs, nursing assistants, can also be charged with patient abuse, patient neglect, and also falsifying documentation. So this information, I want you to take it, have those discussions that you need to have with your family members, your friends, your coworkers, and learn how to protect your patients and your license. All right, so we're going to have an honest and necessary discussion about protecting your license and making patient safety your top priority. Let's face it, your license is your livelihood, and putting patient safety first is the key to keeping it. In this presentation, I'll break down practical steps to safeguard your license, stand up in unsafe work environments, and hold facilities and agencies accountable for doing the right thing. Some of the reasons that majority of the time, it's not that you're a bad nurse or you're a bad CNA, it's that the facilities policies, the understaffing, them giving you too many patients, the acuity level, how critical those patients are based upon your level of experience. Everything falls on you, but at some point we got to put it back on these facilities. So I hope to encourage you and to empower you so that you have the right tools so that you can protect your career and advocate for safer care for patients and also for yourself. And good evening, everybody. I'm not monitoring the chat just yet, but I will monitor the chat shortly. So good evening. Thank you all for joining. These are some examples of recent cases of abuse. In 2025, these cases have occurred. So we're only 12 days into the year. And so this is horrible. There was a nurse and a CNA who were charged with a felony. They put a non-verbal patient in scalding hot water. Allegedly, the temperature of the water was 137 degrees. They left the patient in the water for over 47 minutes and the patient died. At some point, it's beyond abuse. It's just pure evil, as in the case with this nurse from Virginia. She was charged with breaking the bones of Black infants in the NICU, and that hospital ended up closing its NICU. So I want you to, if you see something, say something, even if it's minor or minute. Why are babies having, deformities? This baby didn't have this limb that looked like this yesterday, and now that, this particular nurse has cared for them, this patient looks different. Another instance that has also been brought to light in 2012 is from a Virginia nursing home, 12 staff members. So these just were not nurses. The CNAs also were arrested. The staff members faced multiple charges related to patient abuse and neglect, because a patient died. Once the patient was admitted to the hospital, the hospital realized this patient hasn't had care. The patient hadn't been bathed, the patient had wounds, the patient was really sick, and the patient ended up dying from the lack of care. However, when they went back and they reviewed the documentations, the CNAs were documenting that they were turning the patient, that they were bathing the patient. There is no way, if you have an unsafe assignment, that you can provide the appropriate care to everybody. But if you are documenting that you're doing something, and this was months later, like 2 months later, they were still arresting people. So I want you to really think about it. Should you be working at that facility if you cannot provide the level of care? If you can't turn the patient, you can't bathe the patient, that's probably not a facility you need to be working at. So let's talk about what is falsifying medical records. Falsifying medical records refers to the deliberate act of altering, manipulating, or fabricating documentation related to a patient's medical information or treatment. This unethical practice can include forging signatures, modifying vital signs, changing medication dosages, and omitting important details. Falsifying medical records not only undermines patient safety and care, but also violates legal and ethical standards within the healthcare profession. Your job as a CNA, your job as a nurse, we have to protect patients. We are guardians of patient safety. We have ethical and legal obligations. We take an oath when we go into healthcare. We're going to do more good. So, healthcare professionals must provide safe, effective care to meet both ethical standards and legal requirements. Every decision must be guided by established protocols and practices. In some of your facilities, they now have a central monitoring station. So there is a nurse who can come overhead into a patient's room if a patient is called for assistance, and the nurse via a camera can say, what do you need? What can we bring to you? Well, sometimes, especially if you're a CNA or a secretary at the nurses station, you get alarm fatigue. You're hearing things, you ignore it, you have your ear pod in. How can you recognize if something is unsafe if you are not alert? So I want to make sure that you are not only identifying safety risk, especially with so much technology, but that you will stay vigilant. Do not drop your guard, because if you ignore something, your patient is going to be the one who is going to be damaged. And don't forget about patient advocacy. I am a huge patient advocate. Learn to advocate for patients while protecting your professional license and career. Be a strong voice for patient safety. That is your fundamental responsibility. I want to talk about understanding the stakes. So if you do not listen to what I'm saying, if you go ahead and you decide to accept an unsafe assignment, you accept assignment with 30 patients, and these are, more critical patients. Your patient outcomes, of course, if you can't turn them, they're going to get bed sores. If you can't clean them, they're going to get bed sores. They're going to have skin issues. In addition to that, whenever you are documenting that you're turning this person and they find out that you haven't provided the care, you may lose your license. Now you have to get an attorney. You could be sued. Worse, the patient could die and you can go to jail. So not just your livelihood is on the line, your freedom is on the line. You are a professional with a license. So you have to protect your license. The facility that you're working at did not give you that license. You earned it. You paid for it. You have student loan debt. I need you to protect it with your life, because negligence or failure to uphold safety standards can lead to legal consequences such as lawsuits, fines, and even imprisonment. And I will be checking the chat shortly. All right, so what are some contributors to unsafe conditions? Chronic understaffing. I understand that there is a nursing shortage. Let's talk about this nursing shortage. All right, so you're always going to hear there's a nursing shortage, right? There's not enough nurses, there's not enough CNAs. False. There are enough nurses, there are enough CNAs. We just refuse to risk our license to go into these understaffed locations. So if they're willing to pay more or actually treat us like humans, give us days off, etc., we are not. This new generation of nurses and CNAs, they're not going to risk their family, their quality of care in order to work in some of these locations. And so some of the chronic understaffing has to do with the fact that they don't allow work-life balance at these facilities, and or they found that one nurse who was okay with accepting a patient's a patient load of 50 patients, and now they expect every nurse to do it. I need you to be the nurse who stands up and says, no, this is unsafe and I will not allow it. So the high patient to staff ratios, I just talked about, nurses having 50 patients or CNAs having 50 patients. Whenever you're documenting, if you can't turn somebody, you probably need to be documenting that I couldn't turn this patient every 2 hours because I didn't have enough help. So I want you to really be thinking about this, because at some point the facility's got to be held liable, because otherwise you're the one who's losing your license and you're going to jail, but they didn't do anything to decrease the acuity of the patients or to help with the staffing. So what I'm getting at is that it is also an employer's responsibility to ensure adequate staffing and support. Understaffing and high patient to staff ratios are major contributors to unsafe conditions in healthcare settings. Employers have a responsibility to address these issues to ensure patient safety and staff well being. Another contributor is the fact that you don't understand that you can refuse an assignment. It is not abandonment if it is an unsafe assignment. When they're giving you a report and they're like, yeah, there's 50 patients, or they're giving you a report and the med count is off, uh-uh. You don't have to accept that. You haven't accepted those patients yet. You're just getting a report. That is not patient abandonment. I want you to look into your laws. If you're a CNA, if you're a nurse, you're going to go to your state's board of nursing. I need you to look up what is an unsafe assignment, which you can refuse, versus what is patient abandonment. And I'll discuss them both right now. So, refusing an unsafe assignment, what is it? Declining an assignment that compromises patient or nurse safety. Example, unsafe ratios, or is outside of your scope of practice. You haven't been trained to take care of this level of patient, and yet they gave you that level of patient. Either they're going to reassign that patient, or you may not want to accept that assignment because at the end, it all falls down on you. Is this permissible? Can you refuse an unsafe assignment? Yes. If proper steps are taken, such as you document your concerns, you notify that supervisor, this assignment is unsafe, I cannot take care of 50 patients with one tech, and you follow the policy, they are going to threaten you with abandonment. They're going to threaten you with it. However, I need for you to look up those board of nursing, look at the policies beforehand, because if it's unsafe and you didn't actually say, okay, I'm going to accept this assignment, it is not abandonment. You can refuse. So examples of refusing an unsafe assignment includes insufficient training for a task, unsafe patient nurse to patient ratios. And a key point is that this is not abandonment if reported and resolved properly. If you are a nurse in a nursing home, don't accept the keys. If the NARC count is off, if something's not right, you have too many patients, you have a right to not accept the keys. Let the supervisor know, hey, to find someone else to come in, because you are not going to accept the assignment. Above all, you need to know your rights. So what is patient abandonment? That is when you leave your patients without proper handoff or care. Is it permissible? No, it's unprofessional misconduct. Examples are, well, now that you have accepted the 50 patient assignment, you get ticked mid-shift and you walk out. That is patient abandonment. You should have never accepted the assignment to begin with. Failing to show up after accepting an assignment. So again, if you accept an assignment, you need to be there. You have to see it through. Key point, always ensure continuity of care before leaving. That means that there needs to be somebody else who can provide the care for the person in order for it not to be patient abandonment. So here is a scenario. A nurse is assigned to care for 5 patients during her shift. Midway through the shift, the nurse becomes frustrated with the workload and leaves the facility without notifying their supervisor or ensuring another nurse takes over the care of the patients. As a result, the patients are left without proper monitoring or care, putting their safety at risk, and that is an example of patient abandonment. As a nurse, as a CNA, you have to know your state's requirements. So you can go to your state's Board of Nursing's website, or just go to Google and type in Board of Nursing, unsafe patient assignments, or refusal of care. So refusing unsafe assignments, the Board of Nursing supports it if you document your concerns, you report it to the supervisor, and you propose alternative solutions, such as get another nurse in here. I'm not accepting 50 patients. Patient abandonment, that is a serious violation that can result in license suspension. Never leave your patients once you have accepted the assignment without proper handoff. You want to make sure they have continuous care and that you follow the facility's protocols. Something that we don't consider that is also a contributor to unsafe environments and contributors to these nurses losing their licenses is the fact that our nursing schools, they don't have enough educators. So inadequate training and education can result in nurses who lack the necessary skills and knowledge to provide safe and effective care. A shortage of qualified nursing educators has led to limited capacity in nursing schools. In other words, they can't accept as many nursing students. So they don't have enough teachers to train them. And this results in inadequate training for aspiring nurses. This can lead to gaps in knowledge and skills, ultimately contributing to unsafe nursing practices and compromising patient care. Nursing schools must prioritize recruitment and retention of experienced nurse educators to ensure the development of competent and capable nursing. Well, let's just talk about nurse educators for a moment. Being a nurse educator, you don't make as much money as a bedside nurse. And again, we talked about you having student loans. You have this debt, and you're seeing these nurses who travel around the world. They're making six figures, and you are the one who's responsible for training them. But the college only wants to pay you about $50,000 per year. So until the colleges actually reward nursing educators more, there is not going to be enough qualified nursing educators. A lot of people will work as a nurse educator on the side. And so that's doing the community of nursing a disservice, because those nursing educators should be paid more because they have to train. In a typical class, if you think about nursing school, it may be one nursing educator for 40 to 50 students. So there's no reason why that nurse is only making $50,000 a year. So now the nurse gets burned out, she leaves the school, and she goes and works at the bedside. And so nursing schools have to do better. They have to retain the staff by paying them more, and that will have better educators in place to train the future nurses. So with inadequate training and or knowledge, nurses who lack proper education or ongoing training may be unfamiliar with critical protocols, procedures, or the latest healthcare practices, leading to errors in patient care. So, in addition to your nursing schools not being the best of nursing schools any longer, we also have a problem with lack of experienced preceptors. So now that you're in a facility, you're so happy, I'm doing my clinicals today, and your preceptor sucks, or she's not friendly, or they don't let you do anything. They just let you look. And then we have another issue that we have too many new nurses training new nurses, because the older nurses are like, no, I'm out. I'm not accepting 50 patients. So a shortage of experienced preceptors who can train new nurses also contribute to an inadequate training. When inexperienced nurses are tasked with training other inexperienced nurses, it can lead to a vicious cycle of unsafe practices. Having sufficient experienced preceptors in place can help ensure that new nurses receive adequate training and support to provide care. And then I already talked about the experienced nurses leaving the bedside. If you're not going to pay us, if you're not going to give us work-life balance, we're out. We will open up our own clinics. We will be on YouTube training people so that we have the type of life that we deserve. Staffing shortages and burnout. And I will check the comments in a few moments because I want to hear, some of the things that you have actually endured, because I know it's hard out here. We love our patients. We just don't like the politics of being a nurse or a CNA. So the shortage of healthcare workers can also contribute to inadequate training. When there aren't enough staff to provide care, training, and education, education is not the priority any longer. And so that can lead to a lack of support. So I want you to picture this. You are a brand new CNA. You are a brand new nurse in a facility, and you need help, but no one can help you. And so you go out and do something to the best of your ability. But what you do ends up causing the patient to be harmed. Whose fault is it? Is it your fault, or is it the facility's fault, or is it the preceptor's fault? Everything's going to fall on you. So I try to advocate as much as I can for my baby nurses. I know we're not supposed to use terms of endearment, but my baby nurses and my baby CNAs, I just come online. If you need to learn something, I'll probably teach it to you. But we don't have enough staff in the facilities to teach you some of the life-saving skills, some of the procedures. And so you're learning it, but you're learning it fast paced and you're not retaining it. And so that is also contributing to the lack of quality in care. If you have heard of Redonda, all right, so I'm going to make my screen large again so I can see the text. So whenever we fail to follow policies and procedures, our patients are impacted. So failure to follow policies and procedures can also contribute to patient endangerment. This can occur when nurses are either unaware of the existing policies and protocols or choose not to adhere to them, aka Redonda. In either case, the lack of adherence can result in compromised patient safety and ineffective training of new nurses. So now you saw nurse A do something that wasn't right, and you're like, she took a shortcut, so I'm going to take it too. And so that is how we are teaching these improper practices. They're just going from one nurse to the next nurse. Let's talk about Redonda. In 2017, Redonda, a former registered nurse at Vanderbilt University in Nashville, Tennessee, mistakenly gave vecuronium, which is a paralytic, instead of Versed, a sedative. So in other words, she paralyzed the patient stopped breathing. This error occurred after Redonda overrode the hospital's automated medical dispensing system to access the medication. So this medication wasn't on that patient's profile. You had to go in there and kind of force the machine to give you this medication. And when you did so, your patient died. So the patient became unresponsive and later passed away. Vought was convicted of criminally negligent homicide. And I want to say her license was taken away, but she did not serve jail time. And so whenever you don't follow the established policies and procedures, you are not just taking a shortcut to make your day easier. You're taking a shortcut that could paralyze your patient and kill them. So don't do it. Impaired or distracted nurses. This is the new generation of nursing. First of all, you're busy. You're trying to be on TikTok. You want to show your fancy uniform. Look, you're distracted. Personal device use and external communications can compromise focus during patient care. I need you to focus on your patients, not focus on your phone. Mental health challenges. Everybody is stressed the heck out right now. So emotional strain, psychological stress, all that can affect your clinical judgment. Not only affect your clinical judgment, your patient's yelling at you and you're stressed. Guess what you're going to do to that patient? You're going to yell back. So I try to make sure that whenever I'm working in a facility, I don't really look at my phone. If there's an emergency, you can let me know about that emergency after I get off of work, because it is abandonment if you leave your patients. So I need to make sure that I can stay focused on the task at hand without too many interruptions. And then don't forget physical impairments. You know, you're young, you want to go out all night, but then the next day you want to work a 12-hour shift, or you're young and you want to work 2 jobs. So you're doing 12-hour shifts back to back, and then you're getting double time at hospital B. So now you're working so much until you are physically impaired. Yeah, the money looks good, but what happens when you make a medical error and now you got to use that money to fight lawsuits? So I need for you to take care of yourself, because exhaustion and substance use, even if it's legal, let's say alcohol, can severely impact your ability to deliver patient care. All right, so resistance to feedback or authority and poor communication. Oh, this right here is a mouthful. Look, y'all don't like feedback. Without feedback, you don't get better. So attitude. Some new nurses may struggle to accept constructive criticism or guidance from experienced nurses or supervisors, viewing feedback as overly critical rather than an opportunity for growth. Look, if we can't tell you anything, if you know it all, you know what us experienced nurses are going to do? We're going to shut up and let you figure it out on your own. And that isn't good, because we know the patient is going to be negatively impacted. But what we're not going to do is stress ourselves out in order to teach you something that you refuse to know. So be teachable and be coachable. Lack of respect for authority. Inexperienced nurses might undervalue the expertise of their mentors. Oh, she's just the old nurse. She do it the old way. She does it the right way. Leading to conflicts and missed learning opportunities. And a big one for all age groups, regardless of how long you've been a nurse, is poor communication skills. So effective communication is critical in healthcare, but some new and mature nurses may lack the confidence or the ability to articulate their concerns clearly. So here it is, you're a new nurse, you're Gen Z, and now you are working with a nurse who's in her 60s. She wants things done a certain way, and you're like, I'm not doing that today. She's trying to boss me around. And so she may whenever she talks to you, she may be a little more gruff because in her generation, they didn't have to protect feelings so much. So now there's a communication issue because you two cannot communicate well together, but you have to work together to save the patient's life. So I need you to kind of understand the difference in the communication ways between the different generations. The older nurse may not be mean and the newer nurse may not be sensitive. You're just from two different generations. And I need for you to respect each other to make sure that we communicate and that our patients are taken care of. And I see that people are saying they passed their test. I am so proud of you. All right, so our next slide, everybody. Overconfidence or underconfidence. I am afraid of people who don't ask questions. If you don't ask questions and you know everything, I don't want you on my team. Period. Overconfidence kills. So overconfidence in actions. When nurses overestimate their skills, they may bypass necessary protocols, aka Redonda, and risk making critical mistakes in patient care. Effects of underconfidence. Look, mature nurses, mature CNAs, stop being so mean. When you have somebody who lacks confidence, the way they build their confidence is by you supporting them. It's okay to hold their hand for a little bit. They have a lot to learn. But whenever you are mean to them, they're not going to come to you for help and they're not going to build their confidence. They're also not going to improve their skill set. So excessive hesitation and lack of confidence can lead to delayed decisions and compromised patient care. Let's help them get to the next level. A lot of you have a fear of speaking up or you fear refusing unsafe assignments. So new nurses and CNAs often face significant challenges when advocating for themselves in potentially unsafe situations. So what is the reason that this would happen? Why would you fear speaking up for yourself? Well, I see everybody else does it this way and I don't want to be the only person who doesn't do it. Or if I don't accept this assignment with 50 people, they said they're going to write me up. So fear of retaliation. Remember, you can always go get another job. But how can you get a new nursing license? So I don't want you to fear being written up, potential consequences. They're going to talk about you. They're going to talk about you anyway. So just get over that. They're going to talk about you. So I need you to get over being talked about, fear of retaliation, and go ahead and speak up. You have to find your voice because if you don't find your voice, you won't speak up when your patient is endangered. And then your facilities also normalize unsafe practices. With the normalization of unsafe practices, because everybody does it this way, that means that dangerous shortcuts become routine. And then you're going to struggle because you're like, wow, if I speak up, I'm going to seem like the oddball. I need you to be the oddball. Be the oddball, be the one everybody talks about, but be the one who protects their patients. And then you have a pressure to prove yourself. You're a newbie. You're like, oh yeah, I can work these 12-hour shifts, no problem. I can work this additional fourth 12-hour shift, knowing that you're exhausted. Don't do it. Because we will pressure you to do everything except for to take care of yourself. So I need for you to give yourself grace and understand that you can say no. So you can speak up for yourself nicely. You can also refuse an assignment. You can refuse to come in on your day off, and you are still human, and it's going to be okay. All right, this is one of my favorite topics. We need more nurses in politics, period. We have decision makers who are only concerned about the financial bottom line. They are not concerned about nurses. They are not concerned about CNAs. They are not concerned about patients. They are worried about how much money their company can generate. And so nurses are underrepresented in policymaking. limiting their ability to advocate for safe patient care, those patient ratios that a lot of our governors are like, no, we don't need safe patient ratios. But as soon as you have an unsafe patient ratio and something happens to you, they want to cause you to lose your license and put you in jail. We need more nurses in politics. The challenges is that usually there is limited training and advocacy, demanding schedules, and a lack of confidence may prevent nurses from engaging in politics. But I hope to encourage some of you all, especially my younger nurses, to get out there. We need for you to join these professional organizations, receive advocacy training, and follow the example of nurse leaders in policy making. Whenever we have a lack of safe patient ratios, insufficient staffing compromises patient safety, increases nurse burnout, and leads to poorer outcomes. You can only do so much. So the challenge is that your nurse manager, your director of nurses, they're like, oh no, we can't call in another nurse. We can't call another CNA in. And so you receive resistance from administrators who are focused on cost savings and a lack of enforceable laws mandating safe ratios. So what's the solution? Advocate for yourself, advocate for your patients. And if that doesn't work, find a different environment to work. You should not be stressed out. You can work with kids, you can work in home care, you can start your own business. Nurses have unlimited areas where they can work and where they won't be at risk of being abused by the lack of safe patient ratios. So let's talk about recognizing the red flags in healthcare facilities. All right, so you're at Joe Blow's nursing home and they have chronic understaffing. So like during the interview, you need to be asking, hey, what's the normal nurse to patient ratio? Will I have a CNA? If you're a CNA, you should be asking, well, how many nurses will I be working with? What kind of training will I receive? How many patients will I have? Will I be working on multiple units? So if they are chronically understaffed, that's a red flag. And when you're dating, what do you do at red flags? You get rid of them, right? So in the workplace, same exact thing. Lack of proper equipment. They don't have what you need. They have insufficient or malfunctioning medical equipment. I literally quit a job during orientation. And I'm trying to get my camera back on. So let me tell you why I quit this job during orientation. I quit a job during orientation because they were in a room and they were showing us the medical equipment in case of a cold. And this was a hospital that had people who were on chronic, they had vents, but they would be long-term vents. And so when they brought the crash cart, number one, the bed didn't go in CPR mode. So that was strange. I'm like, okay, well, we're in this room and you're showing us how to use this equipment. The bed doesn't go in CPR mode. There's no monitors. So the only way you know what's going on with your patient is by listening to the actual vent, the machine, whenever it alarms. But you have 12 patients. So if you're in room 1 and the vent is going off in room 12, you won't really be able to be notified. But now when I open up the crash cart, remember I just said these were long-term intubated and trach patients. There was no suction. There was no ambu bag. I quit. I saw my nursing license just taking wings and flying away, and I wasn't giving my nursing license away. In orientation, that was a red flag for me. That was enough for me to know that this facility did not have the proper equipment and that I would not be there. Okay, so I want you to think of things like that. If they are pressuring you to cut corners, no, you won't do so. And if they won't train you properly, those are red flags that you need to go ahead and recognize and find another place to work. I need for you to be prudent nurses. The definition of a prudent nurse is a nurse who exercises sound judgment and protects their license while advocating for patients. When you go up in front of a judge after a patient has been injured and you're fighting for your license, they're going to ask, what would a prudent nurse do? A prudent nurse would have refused that assignment. A prudent nurse would have documented. A prudent nurse would have realized she can't take care of 50 people. And so I need for you to not just understand the definition of being prudent. I need you to evaluate your assignments, assess the situation before you accept it. 50 patients? Nah, Find somebody else. I'm going to call the supervisor respectfully. You can do it nicely. Ask questions and inquire about staffing resources and patient acuity. Patient acuity is how sick are these patients? If you're a CNA and every one of your patients need to be fed and none of them can move independently and you got to turn everybody, that's a heavy patient load. Can you really take care of 30 people who are total care? The answer is no. But if you falsify documentation and act like you have, you're putting yourself and your license at risk, and you can end up not only losing your license, but also end up in jail. So know your limits, assess your scope of practice and comfort level before you accept these patient assignments. All right, so going back to understanding your scope of practice, remember your nurses, you have your LPNs and your RNs. Even though due to the under the short staffing, sometimes some of your states are like changing what LPNs can do. They're changing their tasks, but it's your responsibility to look at that Board of Nursing's website to see what the updates are so that you understand what you can do within your scope of practice. So you have to know that that state's Nursing Practice Act. You also have to know the facility policies, and then you have to know your personal competence area. Where do you need extra help at? So understanding and adhering to your scope of practice is crucial for protecting your license and ensuring patient safety. Regularly review state regulations, facility policies, and your own competencies. So in the state of Florida, everybody, and I'm sure it's happening in other states also, your CNAs with 1 year of experience can become qualified medication aides. They can literally start giving medications in assisted living facilities. The nurse, the LPN or RN, has to supervise the CNA who maybe doesn't know all these medications, who is just popping pills and giving them. Some CNAs, they take their job very seriously, but others just see it as, oh yeah, I don't have to do, task ABC anymore. I'm just going to give these pills. Well, if y'all don't communicate and she doesn't let you know that the patient, now has a rash, or they're saying this medication makes them itch, that's going to be an issue. And ultimately that falls back on the nurse, which is why you have to understand your scope of practice. So if they have a CNA acting as a med aide who is giving medications, but the nurse is responsible for supervising the CNA who's not communicating, you probably need to get rid of that CNA or give her more training, because at the end of the day, if something happens to your patient, it is your license on the line, and a facility is going to blame it on the nurse for not supervising properly. So the power of documentation. Whenever you document, you need to record the incidents, and you need to keep some records for yourself. Now, a nurse unit's not going to tell you what to do or how to do it, but 5 years later, if you're called into the court of law, you need to make sure you write something down. So I need you to record the incidents. Yes, we have the incident report sheets in the facility, but you need to go ahead and start, keeping track of some incidents yourself. You want to maintain your personal record. So keep a personal log of your shift, your patient loads, and any concerns raised, and who you raised the concerns to, and follow up in writing. Your manager's going to hate that. So when they're telling you stuff verbally, you're going to send them an email telling them the way that you understand it. That way you get everything in writing. Written communication, you're creating a paper trail, and that's going to help you save your license. As we discussed, don't be afraid to walk away from an unsafe assignment. Look, you have legal protections. You're going to document. You're going to communicate effectively. And if they can't meet you halfway, if they can't get you better staffing, you need to go. All right, and so some key strategies to protecting your license. We've already discussed you documenting, reporting unsafe practices, and if you need to, you can seek legal representation. Some states do have unions. Florida does not have a union. So whenever you are researching which states you're going to work in, especially if you have a compact license where you can go to multiple states, maybe you would benefit from working in a state that has a union already established. Holding facilities and staffing agencies accountable. So whenever you are documenting the unsafe conditions, it needs to include the dates, the times, the staffing levels, and also specific incidents. Don't forget to include names. You're going to report the concerns, communicate with supervisors, HR, or appropriate regulatory bodies. Just like the hospital can report you to the Board of Nursing, maybe you need to report your supervisor to the Board of Nursing if they continually give you the assignments that have 50 patients. No, that is unsafe. Escalate if necessary. Try to work it out in-house. Try to be a nice person. But when you can't be nice anymore, you may need to escalate it. You're going to use resources like the state nursing boards, OSHA, and Joint Commission. And don't again forget to, whenever you escalate, you can do a consultation with an attorney, seek legal representation, and get some advice. Leveraging the current job market. Y'all, don't be afraid to leave these facilities. Have the gift of goodbye. Look, jobs are looking for safe and experienced nurses and CNAs. So I know starting off as a CNA or a nurse, when you're inexperienced, you take whatever comes. You want to be loyal to the first person who gave you an opportunity. But if you being loyal is also being abused and being mistreated and given extra heavy patient loads, once you have your experience, I need you to go and find a job. So 6 months of experience, you should be okay going somewhere else. And be careful with how you leave, because the medical field is like a small world. You're going to see that person again. So you never want to leave on bad terms, but it's okay to say goodbye nicely. Give your 2 weeks notice or stay on PRN and go find an opportunity full-time somewhere else. So this shift in power dynamics gives you the leverage in healthcare staffing. So remember, if you have experience, if you have a license, you are the cream de la crop. So I want you to use this to your advantage. You can use it to demand safer staffing conditions. Maybe your manager will listen to you and bring in some agency nurses or hire additional staff so that you're not so stressed. You can negotiate better terms. Well, if this is what you want me to do, I'm going to need more money to stay here. So don't be afraid to advocate for yourself. Sometimes we don't have it because we don't ask for it, and they think this is okay. Make sure they watch this presentation. If you need the slides, you can always request the slides, because they're just already in just 2025. There are 3 major cases of nurses who have injured patients, but the facilities also need to be held responsible, not just the nurses and the medical staff. And I want you to drive systemic change, use your voice to advocate for broader improvements in healthcare delivery, building a support system, a network. Professional associations, they have different nurse organizations. Some are in your state. Some could be based off of your race, your religion, peer support groups, and also mentorship programs. Effective communication. It is okay to say I need you to exert yourself. I feel like this assignment is too heavy. I have patients who can't turn themselves, who require breathing treatments every 2 to 4 hours. You gave me 30 patients. I don't feel safe here. I don't feel supported. Use those I statements. Assert yourself. Offer solutions. Remember, every time you bring a problem to your manager, to your boss, to your charge nurse, I want you to bring a solution too. So just don't be so problem. We don't want anybody who's nagging all the time. You need to go ahead and present the problem and present a solution and see how they respond to the solution that you presented. And don't forget to document your interactions. Self-care. Yes. Physical health. So prioritize, because nursing is brutal on the body. Whether you're a CNA or a nurse, I need you to prioritize your physical health. You're going to make sure you exercise, get some sleep, and also eat healthier. Rest your brain, your mental well-being, reduce stress. So meditation, counseling, they even have online counseling platforms where if you need a mental health break, go to the beach. I call it getting some vitamin C, go ahead, take a walk, some vitamin D, get some sunlight in. Work-life balance. Stop working so much. Take a break. Set boundaries and make time for personal interests and relationships. And don't forget, you have the keys. You can leave that facility and seek other opportunities. You can reignite your passion. So maybe you don't need to be working 2 full-time nursing jobs. You're at one hospital 3 days a week and the other hospital 3 days a week. Maybe you need to work one nursing job and do one of your hobbies. Turn your hobby into a business. And that way you're doing something you love. All right, so in order to shape the future of nursing and your healthcare, just doing a recap, we're going to advocate for change. We're going to embrace leadership. We're going to mentor others the same way that I and many other online nurses mentor our future nurses, our future CNAs, our current nurses, our baby nurses, and we're going to be innovative. And so we can contribute to the development of new nursing practices and technologies. And we need to stay current. You have to keep learning. You never want to stop learning. So they have the continuing education units, those quick courses you can take for your CEU hours. If you want to get a specialty certification, that will get you off of the floor. So if they are giving you 30 patients in a nursing home, in a hospital, you're probably going to get 10 patients on a med surg unit, 8 to 10 patients. Well, if you specialize and you go into critical care, you may only have 2 to 3 patients, depending on the acuity of those patients. So specialization means that you're going to have, the patients may be more critical, but at least you will have fewer of them. And then for continued learning resources, don't forget that Florida Training Academy, that is my business. We have all these videos on YouTube. And then I also have my personal channel, which is nurseeunice.com. Or if you go to YouTube, it is youtube.com/Eunice Mathis. And if there is a subject that you want discussed, that you want more information about, my team and I, we try to work really hard to make sure that we can get those videos out to you as soon as possible. But I want to make sure that we are providing you with the knowledge and the resources you need, because I know how hard it is out there in the field. And I know that sometimes you don't want to talk to Nurse Becky because she's mean. I want to be the nurse that you can talk to, that can advocate for you and that can help you stay a nurse for as long as possible, or a CNA. So our conclusion and call to action, I want to thank you all and just for being here, for actually caring to learn enough about how to protect your license, not being afraid to refuse an assignment, to understand the state laws and to stand strong, to stand up for yourself and your patients. Your voice matters. If you don't stand up for your patients, who will? And everybody, my heartfelt thank you. So thank you so much for watching the important discussion and for subscribing to my channel. Your dedication in protecting patients and serving our community does not go unnoticed. And I'm truly grateful for all that you do. Remember, as healthcare professionals, we have the power to make a lasting impact by prioritizing patient safety and advocating for ethical practices. If you'd like a copy of these slides, feel free to email me at emathis@fltraining.com. Why would you want a copy of these slides? Because there are some conversations that you need to be having with your coworkers. There are conversations you need to be having in your nursing school, because we don't want you all abused. We want you to stay in the nursing field. And we also want you to stay in the nursing field with safe ratios so that you can keep our patients safe. So stay connected with me for more resources and tips to help you in your career. And until next time, take care. Thank you for making a difference. And I'm going to be in the chat responding to your messages. I do apologize. I didn't have a moderator today, so I did not check the chat sooner. So I do apologize for that. But thank you, everybody. And I'll be checking the comments in the chat right now.